Sofosbuvir and Ribavirin in HCV genotypes 2 and 3. Definition: of the 6 main genotypes of the hepatitis C virus, genotypes 2 and 3 account for approximately 30% of chronic infections worldwide. Although these two genotypes have historically been grouped together in treatment guidelines and clinical trials, accumulating evidence suggests that there are important clinical differences between them. HCV genotype 3 infection is associated with a higher incidence of hepatic steatosis, more rapid progression of fibrosis, and possibly a greater risk of hepatocellular carcinoma than is HCV genotype 2 infection. Until recently, patient interferon plus ribavirin administered for 24 weeks.
Chronic hepatitis C virus infection, or HCV, causes progressive liver fibrosis, which can lead to cirrhosis and hepatocellular carcinoma. An oral regimen that would treat patients infected with many of the possible viral genotypes was tested in this Phase 3 double-blind placebo-controlled trial. Treatment-naive and previously treated patients with HCV were enrolled at multiple sites in the United States, Canada, Europe, and Hong Kong. All of the patients were chronically infected with HCV 1, 2, 4, 5, or 6. Patients with and patients without compensated cirrhosis were included. Study participants received 1 tablet daily containing either Sofosbuvir and Ribavirin or placebo for 12 weeks. The primary endpoint was a sustained virologic response 12 weeks after the end of therapy. Of the 624 patients who received Sofosbuvir Ribavirin, 99% had a sustained virologic response. None of the patients given placebo had a sustained virologic response. 15 patients who received Sofosbuvir Ribavirin had serious adverse events. The most common adverse events were headache, fatigue, nasopharyngitis, and nausea. The authors conclude that once-daily Sofosbuvir Ribavirin for 12 weeks provided high rates of sustained virologic response in treatment-naive and previously treated patients who were chronically infected with HCV 1, 2, 4, 5, or 6.
Application in medicine. In clinical trials, treatment with a combination of the nucleopolymerase polymerase inhibitor Sofosbuvir and the antiviral drug Ribavirin was associated with high response rates among patients with hepatitis C virus genotype 2 infection, with low response rates among patients with HCV genotype 3 infection.
Number 5. Hepatitis C protease-inhibiting drugs.
Hepatitis C, a common liver disease that affects an estimated 3.9 million people in the U.S., is typically diagnosed when abnormal liver enzymes are identified through a routine blood test, or if the infection becomes severe. 70% of patients with hepatitis C develop chronic disease, and 30% may develop cirrhosis of the liver within 20 years of exposure to the virus. An additional 20% of these patients eventually develop liver cancer. Total medical costs for people with hepatitis C are approximately $30 billion. The best cure rates of about 40% include combination of the oral antiviral medicine ribavirin and an injectable interferon.
Pros and cons. Pros. Patients receiving Sofosbuvir Ribavirin had substantial reduction in circulating HCV RNA levels during the first week of treatment. By week 4 of treatment, 99% of the patients had an HCV RNA level of less than 25 IU per milliliter. Cons. 1 patient in the placebo group discontinued therapy because of elevated alanine aminotransferase and aspartate aminotransferase levels. 1 patient with HCV genotype 3 infection receiving 12 weeks of treatment discontinued because of malaise and headache. And 1 patient with HCV genotype 3 receiving 24 weeks of treatment discontinued after attempting suicide. Diarrhea and irritability were observed more frequently in the 24-week group than in the 12-week group.
How does it feel to be cured?
It's positive for me. It's nothing but positive for me. I'm taking risks I'd never thought I'd take. I'm stepping up and talking about my story.
I feel like I got a new lease on life, to tell you the truth, because now that I have knowledge of the disease,
I am bringing awareness to as many people as I can, and I'm taking every opportunity I can to share my story, to share my journey.
As far as hepatitis C, I've been cured. As far as stage 4 cirrhosis, I have been cured. As far as liver cancer, I have been cured, and I am excited about that.
I feel like I've been given an extension. I was in a great fog for a long time. There are so many things that I still want to do. I really am happy.
I feel wonderful now. It was all worth it, because I want to live long.
Today,
Issue applied in Ecuador. A total of 475 patients were screened for enrollment. Of these patients, 421 underwent randomization and 419 began treatment. Overall, 40% were women, 21% had cirrhosis, and 58 had been previously treated for HCV infection, of whom 30% had had no response. The characteristics of the patients were generally balanced among the study groups, with expected differences between patients with HCV genotype 2 infection and those with HCV genotype 3 infection.
The first 2 times I went through treatment, I had a lot that I was dealing with. I was pre-transplant, but I stuck to it and I made it through the treatment.
I had 5 treatments before I really got cured of hepatitis. So it was a process.
the first time the treatment failed, I was kind of bummed out about that. The second time the treatment failed, I was pretty devastated. And my hepatitis C went to stage 4 cirrhosis and to liver cancer.
I didn't realize until after I was done with treatment how hard the treatment really was. The side effects were just overwhelming.
Today, I'm very optimistic and excited about treatment for all aspects of liver disease.
Well, there are
Conclusion. Sofosbuvir is an oral nucleotide analog inhibitor of the HCV and S5B polymerase that is effective against HCV genotypes 2 and 3 when it is administered in combination with ribavirin. In phase 3 trials involving patients with HCV genotype 2 or 3 infection, therapy with Sofosbuvir ribavirin for 12 weeks resulted in rates of sustained virologic response of 67% among patients who had not undergone previous interferon-based therapy and 78% among patients for whom interferon therapy was not possible because of contraindications or in whom unacceptable side effects developed.
So HCV stands for high conservation value areas. It's an approach to be able to manage on a landscape level your natural resources. There are a number of different criteria that one looks at in terms of high conservation value areas. These could be species, ecosystem services, cultural, habitat, and community needs. So typically, a concessionaire will use this approach to be able to identify where any of these different criteria conservation areas exist within his landholding or concession. To conduct this approach, consultants or experts within the field of each of these different conservation value areas will evaluate a concession or landholding to be able to identify where these sites of specific conservation interest will be. For example,